Well, I'm Dr. M. Wali, Padma Shri Awardee. I work at Sir Ganga Ram Hospital as senior consultant in the Department of Medicine. It's time to talk about patients. Government of India recently has done a lot for Indian patients and also for the tourism, that is medical tourism, and we still provide the best treatment for our patients and medical tourism at a very competitive price. Every year something has to be done. Government has done quite a drastic reduction in the costs, especially when we talk of stents. But there are some other devices like heart valves and some less talked devices like pacemakers, cardioverter, implantable cardioverters, and defibrillator, which are quite expensive, say to the tune of 10 to 12 lakhs. So the government has to take care of it and fix the responsibility for some department to reduce the price for the patient. And there are further to it some prostheses, some other devices like brain shunts, which are also quite expensive. So overall, whatever the appliances used, like eye lens is very cheap in India. Same way, cardiac valves should also be cheaper because we have lots and lots of patients who need them. The other thing is that Ayushman Bharat Yojana, which PMJ Shri Narendra Modi ji has developed and spread and introduced in a bigger way throughout the country. There are some states which have not accepted it, so they should be made to realize the importance and accept it. And through this scheme, more coverage to the poor beneficiaries should be given and more hospitals should be registered. That's my suggestion. We are already doing good work in this direction and lots of people are getting the benefit of this scheme. Apart from that, the government has come out with very sound national health policy. And in this policy, the stress was given on the primary health care. Primary health care is concern of every citizen and is cheaper. And if it is redistributed at the periphery, then the cost cutting is automatically done. So the already existing dispensaries which are run by the central government in many districts, headquarters and many big cities are to be revamped, and new centers, wellness centers are being opened. They should be further developed. The practical problem with these centers is staff. So new staff has to be recruited, paramedical and medical both. Then the doctors should be going to the villages. That's also very important because my India lives in villages. Doctors should go and willingly work there. For this very important point, there should be basic infrastructural facilities for the doctors and their families to live, because this is the common pretext on which doctors are not very much willing to go to the rural areas, and that's a great difficulty. Then, apart from development of the primary healthcare centers, there is also a need for immediate emergency care. We are lagging quite behind in emergency medicine. So, more seats in the medical college for emergency medicines should be opened, and both at graduate and postgraduate level, this should be taught. Also, trauma medicine should be covered in this because accidents are still major cause of death in India. Then comes the maternal and child health. Our existing hospitals, most of them do not have neonatal ICUs. A lot of children die. We recently see lots of children have died in Kota. That's not because of any other reason, but because the ICU management for the young children is inadequate. So more neonatal ICUs should be opened, and more ICUs also in the established hospital, more ICU beds should be there so that more patients of emergencies, trauma, post-operative, head injury, brain strokes, heart attacks should be accommodated. Apart from this, vaccination program. We have effective vaccination program. Shri J.P. Nadda ji, when he was health minister, he introduced Indradhanush program, and that is working very well. Our polio program is working very well and internationally acclaimed. So the outreach of these programs has to be increased. Then another issue concerning doctors is that there was a bill introduced by our Honorable Health Minister Dr. Harshvardhan for assault on doctors to be made unbailable and a punishable crime. That bill has to be passed both in Rajya Sabha and Lok Sabha. The government should protect the interests of the doctors who are serving. And most importantly, the introduction of all these schemes to reach the masses. And we have pollution as a great problem. So pollution reduction and all the measures are to be effectively implemented with a good political will, because we waste so much money after people suffer due to the hazards of pollution. And elderly also need under one roof care. So there should be schemes and introduction of geriatric medicine in all the medical colleges as a teaching subject, and also Department of Geriatric Medicine, in which a patient goes and get care for prostate, stomach, brain, neurological conditions, heart conditions, liver conditions, urinary conditions, and whatever he suffers from at the old age. So with this kind of approach, I think we can have another step marching forward in the medical field and good for the nation. As I told, medical tourism is also increasing in India at a very competitive price. So we have to probably open some centers abroad that we can make them as catchment areas. This is all what comes to my mind at present. Thank you.